Side effect management is a huge part of my job to help patients maintain their adherence to treatment. Identifying their needs early on is crucial. Making sure that they are taking all of their medication properly, whether it be medication for their blood pressure to keep it under control, whether it be making sure that they are checking their glucose at home so that we know if they're having uncontrolled issues with their diabetes. There's many things that come into account. It's very important that we identify issues early on. There are side effects from treatment that can exacerbate some of their comorbidities, and that's why it's important to kind of get things controlled early on. So educating patients on their side effects of treatment so that they know how to manage them and to help reduce some of the burden of their treatment so that they can maintain treatment without having treatment delays, without having to skip a dose or, God forbid, be hospitalized for dehydration. It's important that we educate patients early on what symptoms to expect from this treatment, what are the more common symptoms, and how to manage those symptoms and when to call me. That's often the biggest challenge that I find is patients may not call you and then they'll come in to see you, 2 weeks later, and they'll be having this awful symptom that you could have helped early on. So it's really important to constantly be educating them on what's appropriate, how to manage their side effects. They're dealing with such a huge impact on their life, and they don't always retain all the information that you give them because it's just so overwhelming. So you constantly have to educate them on the proper side effects and how to manage their side effects as well as their family members. The nurses that I work with play a huge role in this too, to help us kind of keep patients on point. So it's really a team approach. When a patient experiences an adverse event, for instance, if a patient was suffering from diarrhea from treatment, we first and foremost ask them to call us when they're suffering from it. And we have a nursing triage line at our work, so all the nurses are broken up by disease site. So the nurses that work with me are highly educated on the treatments that we give and their side effects and how to manage those. So for instance, if a patient's having an adverse event, they would first and foremost call us so that we can identify the next appropriate step for them. Whether it be that they have to go to an emergency room or come in to be seen at triage versus if it's a more mild type of adverse event that they can manage at home. The nurse can kind of educate them and or if they require my input as well so that we're kind of keeping things under control early on. This way the patients can continue therapy as planned versus if an adverse event occurs and there's not early intervention, it could lead to us having to hold treatment or delay therapy. So definitely we educate our patients on how to control their symptoms at home in an adverse event, depending on whether it is, and also alerting us to the event so that we can manage the symptom the best that we can.